Ambulatory emergency care is a new concept in emergency care that is sweeping across England, and it's about providing services so that patients can be assessed, treated and diagnosed same day. Watford General Hospital at West Herts is an excellent example of what can be achieved by redesigning your emergency services to provide ambulatory emergency care. We've been working with them and have been very impressed by their achievements and the service that they're providing for patients. When they show visitors round, they're keen to share with them their experiences at the start.
Ambulatory care at West Herts started from a broom cupboard in August 2012. So we had chairs down here on the left. This was our reception area and our one consultant room, which I'll show you here. It's been converted into a sister's office now, but in here we had the sink and then a trolley down to the right-hand side. We had space for one trolley and a desk in that cupboard. Outside of the cupboard we had some chairs and our dedicated reception. We immediately saw the impact of ambulatory care from that one trolley space. We saw that with our A&E attendances and also from our medical take. So we had more throughput through the medical take and more flow. Therefore, we knew that we had to develop ambulatory care further and have our dedicated unit.
This was the platform for me to be able to start building a business case that demonstrated if you had a robust, well-staffed ambulatory service, it essentially paid for itself by reducing bed days.
One of the key areas I'd like to take our visitors to see is our nurse controller. The nurse controller is there to filter patients from GP or A&E to the most appropriate place for their care. There's plans going forward for this role to be taken by an acute physician in line with recommendations from the Royal College. So this opened in January of this year. Our new unit has its own dedicated waiting area. So at this point of the patient journey, the patient will be booking in with a receptionist. They'll be confirming their personal details. After that, they'll proceed through to the nurse assessment room. So here we have an initial triage taking place with one of our healthcare assistants. At this point, the patient will receive OBS, ECG and also their swabs, and then will possibly go back into the waiting room to await assessment by the junior doctor. Next, the patient will proceed through to one of the consulting rooms where they'll be seen by a junior doctor. This will be a full clerking, and after that will then be assessed by a consultant.
As regards patient selection, we got 17 clinical pathways, but I would like to emphasize that we are process driven and we consider any patient who are stable enough to be managed through the ambulatory care unit. On average day, we manage 45 to 55 patients.
To ensure throughput through the ambulatory care, patients often come into the unit, into an assessment area, and then return to the waiting area if they're fit to do so. So coming through, we have 6 consulting rooms and a treatment room, plus a 5 trolleyed female recliner area and a 5 trolleyed male area. And then we also have our recliner area here, so when people come in for their IVs, they'll take a seat there.
From a nursing perspective, ambulatory care is hugely rewarding. There's a lot of responsibility. Some of the areas of the clinic are completely nurse-led, such as the deep vein thrombosis clinic. There's lots of opportunities as well for nurses to go on and do their advanced nurse practitioner, that they're able to perhaps do a prescriber's course and therefore an extended role in ambulatory care.
We have the DVT clinic operating from here and also the elderly care. The elderly ambulatory service also operates from the same unit and they have a dedicated staff grade and consultant. This service gives elderly patients or people with frailty a full comprehensive geriatric assessment. Hot clinics also operate from the ambulatory care unit. These are for patients that may be well enough to be discharged but not well enough to wait for a general outpatient. So consultants can safely discharge the patient with the confidence that the patient will be seen within 1 week of being discharged by the specialist. At present, we operate a rheumatology and cardiology clinic with plans for neurology to come on board in the near future. So just some views really of how you feel about ambulatory care and your experience so far.
Well, I've been coming here now for 2.5 years. I have a PICC line because I have gastroparesis, and this ambulatory care is very good for me because I can go home on a cannulator when my PICC line's being dealt with, and then I can come back every day.
You know, you've got individual care here and the flexibility of the whole situation. Come in for your treatment, spend 2 or 3 hours here, and then go home. Because really, if you're in hospital, nothing much happens between those actual treatment hours. You know, otherwise I'd be costing the NHS money, sitting in a bed, waiting for my next hour's treatment tomorrow.
In terms of the numbers of patients that are going through the ambulatory service, we're looking at avoiding 20 to 30 admissions per day, with those patients often having a length of stay of over 2 days. So it was very apparent very quickly that the business case would be supported.